Hello, my name is Hailee Desrosier, and this is the story of how I was infected with MRSA. It was just a normal day at school until I got to my science class. My teacher, Mr. Prof, was teaching the class about evolution and adaptation, specifically in bacteria. He was telling us how bacteria, over time, has been able to become resistant to certain antibiotics because some of their offspring had a mutation in their genes that makes them immune to the antibiotics. Sadly, no one was listening to him, and suddenly he got very angry.
I'm disappointed in all of you. How can you all just sit there talking while I'm teaching?
I was brave enough to respond with, "Well, it's not like we need to know any of this."
That's not true. If you get an infection that is immune to certain antibiotics, you need to know how you can attack it and how it attacks you.
Whatever, never gonna happen to me.
You'll see. Class dismissed.
I had no idea what was going to happen next. I never would have guessed. Mr. Prof was upset with his class, especially me. But who would have guessed what he would have done next? That's right. Mr. Prof was actually Staffman, an evil man who attacks people with certain strains of staphylococcus aureus, and he infected me with the worst kind, MRSA. Here, I'll explain what staphylococcus aureus is. It is a type of bacteria, and there are many types of it, so I'll just list a few and then give a quick explanation for them. There's skin infections, food and blood poisoning, toxic shock syndrome, septic arthritis, and MRSA. For skin infections that are caused by staphylococcus aureus, or staph for short, there are boils, impetigo, cellulitis, and staphylococcal scalded skin syndrome. Boils are pockets of pus that are grown in hair follicles or oil glands. Impetigo is a rash that is made of golden-colored, ooze-filled blisters. Cellulitis occurs in the deep part of the skin, and you can tell you're infected because of the swelling that occurs. And for triple S syndrome, it only affects newborns and children, and it causes them to look like they are burned in the infected area because of the toxins of the infection reacting with the skin. You can also get a staph infection caused by eating bad food, as well as getting the infection in your blood. The staph infection correlated to food poisoning is a very common kind of poisoning. It's not that harmful. The symptoms don't include a fever, but it has a common symptoms often associated with food poisoning. For blood poisoning, the only time the staph can infect is if it enters your bloodstream. The symptoms for this are fever and low blood pressure. Once in your body, it'll infect your organs, muscles, and even devices implanted from surgery. Toxic shock syndrome is a life-threatening condition due to toxins created by the staph infection. This is caused by anything dealing with your body that has a chance of infection from any bacteria. The symptoms are telltale signs, the big ones being confusion, high fever, and related symptoms, muscle ache, and abdominal pain. Septic arthritis is a type of arthritis caused by a staph infection. It only attacks the joints where you would notice swelling, severe pain, and you would have a fever. And finally, the staph infection Staffman infected me with, MRSA. MRSA is an acronym for methicillin-resistant staphylococcus aureus. Penicillins and penicillin-related antibiotics do not work on this staph infection. This makes it different than the other staphylococcus aureus infections because it is also more aggressive. MRSA exists because in 1944, staphylococcus aureus was exposed to a lot of beta-lactam drugs to get rid of it, but it adapted, making it resistant to penicillin-like drugs, just like Mr. Prophet said. Out of the whole population on Earth, only 2% carries MRSA on their bodies. Whew! Did you get all that? It was a lot of info to take in. Anyway, let's get back to the story. I got home from school that day thinking nothing out of the ordinary had happened. After doing my homework, I decided to take a nap. My left knee was hurting just a little, but I didn't think much of it. However, when I woke up, I had this severe pain in my knee. The pain got so bad I had to call a doctor. The doctor told me he thought I had some kind of staph infection and wanted to see me right away. So, I went to his office. Once there, he asked me if I could show him my knee. It hurt so much, but he told me he knew exactly what it was, MRSA. He also wanted to know if I had come in contact with anything via skin-to-skin contact, razors, sports equipment, towels, or environmental services like mats. I told him I did none of those things, so then he asked me if Staffman caused this, because these are the only ways to get MRSA if you aren't part of the 2% that has him already. I told him I may have, but I don't know who he is.
Why, he's Mr. Prof.
Wow! Are you serious? How do you know?
Because I'm clindamycin man. He's my nemesis.
If he's your nemesis, then you must know how to get rid of my MRSA. I was eager to get rid of the pain.
Sadly, I cannot get rid of the pain just by zapping you. Here, let me explain to you MRSA's molecular structure first. As mentioned earlier, MRSA is a type of strain of Staphylococcus aureus that is far more aggressive, and it is even resistant to semi-synthetic penicillins. This gives it its nickname, the Superbug. In order to understand how MRSA can attack its host, first you must learn its molecular structure. In a microscope, looking at MRSA, you would notice it is gram-positive, meaning it has a very thick cell wall. It is also non-modal, where it doesn't show any motion. As you can see in the photo, it is also spherical, a golden color, and it grows in chains. It looks very similar to a bunch of grapes. Huh.
That's right. I remember doing a science fair project on how MRSA attacks when I was in 3rd grade. Here, let me explain to you how that works. Here's some quick background knowledge for MRSA as well. Coagulase is an extracellular protein that binds to prothrombin, which helps clot blood. Lipases, proteases, and DNase are all types of enzymes used to provide nutrients for the bacteria of MRSA. Staphylococcus, or SAC, activates the precursor to the enzyme plasmin, which dissolves fibrin clots. And finally, hyaluronidase is an enzyme that breaks down the hyaluronic acid so MRSA can infect more of its host. Finally, you can learn how MRSA attacks its host. Step 1. MRSA enters its host, most likely from another infected organism. From there, the coagulase creates a massive complex called staphylothrombin, which causes a huge blood clot, which keeps the host's bodily defenses cut off from the infection site, like a roadblock. Step 2. Staphylococcus dissolves the fibrin clots, which are basically just blood clots, by forcing plasminogen to convert to the plasmin enzyme, which will attack and destroy the blood clots. Step 3. Once the blood clots are destroyed, MRSA uses a hyaluronidase to move throughout the host and continue infecting it, while still setting up camp every now and then. Those are the 3 steps for infection of MRSA, but it's not that simple. There are other things that go on throughout the steps that helps MRSA thrive. In MRSA, there's a cytotoxin, a substance toxic to living cells, called leukocidins. Leukocidins kill white blood cells. The pus you can see at the infected site is made up of those dead white blood cells. There are also 2 other types of toxins, alpha and beta toxin. The alpha toxin deals with a substance in the blood that destroys the red blood cells, freeing the hemoglobin. That substance is called hemolysin. Alpha toxin is a monomer that binds to the host's cell membrane. It then combines with other alpha toxin monomers where it becomes an oligomer, which has less monomers than a polymer. When oligomerizing, like shown in the picture, it makes heptameric rings with a ring in the center that causes a leakage of the contents of a cell, specifically the host cell. Beta toxin breaks the membrane lipids down using water. Using both alpha and beta toxins, MRSA is able to go through all the steps to infect the host over and over again. Now that you know how MRSA attacks, you're probably wondering how it can be treated, and that's exactly what I asked clindamycin man. He told me taking either doxycycline, minocycline, rifampin, linezolid, clindamycin, or other antibiotics that are not penicillin related should get rid of it. Take that, staff man! My name is Hailee Desrosier from Shorecrest High School, and this was MRSA, Superbug of the Century.